Hi and welcome to the second video in this exploration of mental health services. Now, in this video I'm going to talk about the specific trust that I am under. I live in Essex, and since 2010 the national NHS austerity policies, local government budget cuts and real terms mental health funding freezes have completely restructured how psychological treatment is delivered. Now, like I said, I'm going to be talking about the trust that I'm under, which is EPUT, Essex Partnership Trust. But I would assume that there are other trusts that would have similar problems, especially if they have a similar demographic makeup. So, what they did to account for the austerity policies and everything else is they decoupled long-term psychotherapy. So to save money, funding shifted from intensive long-term secondary care psychotherapy, that's psychoanalytic and psychodynamic therapies, to short-term primary care treatments, or the improved access to psychological therapies. High-intensity one-to-one psychotherapy departments were systematically downsized, replaced by cheaper, structured CBT models, digital text-based courses, and group-based therapy sessions. Now, some people, group therapy is great, not for others. I'm someone who had a good experience with my first group. My second group was absolutely terrible. The third group wasn't long enough for us to achieve anything. Something else that happened because of the cuts was workforce de-skilling and grade down banding. Rather than funding highly trained senior clinical psychologists and psychotherapists, cuts forced reliance on cheaper alternatives, and the lower tier roles are, as I said in the last video, psychological well-being practitioners or trainee assistant psychologists. Complex care deficit happened, which kept the primary care numbers high but left the trust without enough specialised clinicians capable of treating patients with deep-rooted trauma or complex personality conditions, which is the category I fall under. And that's the secondary care. They started doing out-of-area referrals and a backlog accumulated. With the loss of the specialised staff, it destroyed the trust's capacity to handle referrals. The trust increasingly relied on sending complex patients out of area to private clinics or alternative trusts at immense cost. Adult patients who couldn't be referred elsewhere were placed on multi-year bottlenecks. And that's where I'm stuck. Fragmented services were caused by the merger between SEPT, the South Essex Partnership Trust, and the North Essex Partnership Trust. In April 2017, SEPT and NET were forced to cut admin costs and achieve efficiency savings, which is cuts. The merger created a highly fragmented patchwork of therapy protocols. It also caused a big problem because SET wasn't really handling the south of Essex with the greatest success. It was doing better than North Essex, but what happened was when it merged, some of the service got taken away from the south and moved into the north to patch their problems, leaving the south of Essex a postcode lottery. And in the part of South Essex where I live, it's a real postcode lottery. We are the losers in the postcode lottery. There was an increased reliance on the third sector, so that's outsourcing talking therapies and psychological provisions, sorry I can't read my own writing there, to third-party charities or private partnerships under the banner Therapy for You. It stabilised mid to moderate mental health tracking figures, but left secondary care psychotherapy isolated and under-resourced. One of the other big problems during the Tory years, and has not been changed, is that there was a fundamental push from diverting funds from programs that might have been helpful for the patients to work-focused stuff. So everything was about getting people into work, even if there was no possibility of that person getting back into work because of whatever mental health condition they had. Some mental health conditions you cannot recover from. You can live with them, but there's no cure. And this was a problem because I was part of a project that went all over Essex, funded by all the mental health commissioners, and we came up with loads of ideas from talking to other mental health service users in stuff that would have helped people and might have got them back into at least some semblance of independent living. Unfortunately, that was all fucked up by the Tories who wanted everything work focused. Gotta get them back into work. They're all scroungers. All swinging a leg, doing sod all, sitting there doing nothing. Well, I've become one of those people because all the work we did, we were betrayed. And that had a negative effect on my mental health. And when I was really getting close to being able to get back to work, 3 major life events happened all at once that destroyed me completely. And now I can't go out and do what I used to do. The voluntary work that I tried to do. And it wasn't just with people with mental health problems. I was going out and I was helping people with basic computer skills. I was doing, I was on the board of governors at the local adult college. I was also a student and a volunteer there as well. I was, from what I remember, I was the first person to be a student, a member of the board, and a volunteer. Other people followed me, whether that is true, whether I really was the first or whether they were just trying to butter me up. It was, I was doing stuff. I can't do that anymore, and I'm not getting the treatment that might help me. And talking about taking specialised, qualified people out, I was under a brilliant employment specialist. He was helping me find jobs that I wouldn't have thought of going for. He was kicked out. I don't know whether he's moved somewhere else in the trust or whether he was just let go. He was replaced by someone who was not good. She was very bad at the job. She did get me onto a course, health and social care course. It was a course I didn't want to be on to do a job I didn't want to do. That was how good she was. She was pushing me into a line of work that would have made me worse anyway, because I did not want to be what I would have become, which was a paid carer. I had that with my grandma. I was not paid, but I cannot bring myself to be a carer, paid or otherwise. I will do it for my ex-wife, but no one else. And while I was on that course, I was supposed to be printing out something at the college. It was a little booklet that I had to do for an assignment. We weren't given any leeway. It had to be in on a particular Friday, and I didn't have a printer at home, and all their printers were screwed up at the college. And so I came home and tried to kill myself. Sounds stupid, but it was a lot of frustration over being on a course I didn't want, and then to be caught up in a snafu with the equipment, so I wouldn't have been able to get my assignment in, and I just couldn't do it. And then I had to be moved out of my immediate area to another part of the trust, and I was with a woman again. Nice, she was a nice person, but it didn't work out. She got me interested in doing a initial teacher training course to underpin the work I was doing at a local university, where I was giving lectures about having mental ill health. And the problem was that she was a very committed Christian and seemed to be more interested in getting me to believe in God, and she was on a hiding to nothing there, and it didn't affect me that badly. But she was let go, I heard later, because someone complained that she was trying to bring them into the fold of Christianity. And, you know, so I had two experiences that weren't particularly good because they got rid of someone who was really good. Absolutely fantastic. And so this is the problem. And the final problem, and this is, I assume, a wider problem. There was a funding model where the trust got more money for each new referral. I don't know whether that still applies, but it did a decade ago. So what they were incentivized to do was get you just well enough to be able to go out and then know that a few weeks down the line you are going to crash out and you get referred in as a new patient. So they had no incentive of actually getting someone who could be completely sorted, because they got more money for each time you went back. Each time they signed you off, soon as you came back, they got paid more. So I don't know whether that funding structure is still there. But if it is, that's something else that's got to change too. But we need more money in the mental health service. We need to go back to the sort of stuff that helps people live independently, to gradually get back into some kind of normal life. And then, if you've got the staff, if you've got the projects that will aid people's recovery, if recovery is possible, or to be able to live with your condition, then maybe more people would be able to go out and get a job. Cutting away at the mental health service has done nothing. And yet, people with mental health problems who are on benefits are the ones targeted the most. Because people don't understand mental health like sufferers do, and like society should. So, Andy Burnham, if you really want to pin your colours to mental health, you're going to have to do a lot of fucking work, and it's not just opening up a few centres. Anyway, if you found this interesting, please click the like button, share with anyone you think might be interested, especially if you're a mental health service user yourself, try sending it to your useless MP. And as always, I'd like to hear what your experience is, so put it in the comment section underneath this video. And if you want more videos on various subjects, why not click the subscribe button and the notification bell so you know when I've dropped another video. And I hope this two-part exploration of the mental health service deficits, then my time hasn't been wasted. And I hope to see you again soon.